Hello everyone. I know that this is not the best way to teach anatomy, but you know the situation. This is what we have, so I just want to help you. I will do my best as usually. Today I want to speak you about the pharynx. If you remember last time we started the digestive system and I told you that this system is formed by the digestive tube and the organs which are connected with this tube. These organs, for example, salivary glands, the liver, and the pancreas. And the first organ of the digestive tube was the oral cavity. We spoke about it last time. Let's see this picture. It's a sagittal section, so you can see the nose right here, the nasal cavity, which is separated by the oral cavity. You can see here the palatine region. So palatine region with the hard palate, the white part, hard palate orientated in front, and the soft palate which is behind. If we take the pharynx, because of its position, we can consider it an organ um, which is a part of respiratory system and in the same time a part of the digestive system. Let's see why. You can see that pharynx can be divided in three parts: nasopharynx, oropharynx, and laryngopharynx. The name of this part is determined by the relations. So nasopharynx is behind of the nose, oropharynx behind of the oral cavity, and laryngopharynx and or hypopharynx, if you want, it's located behind of the larynx. Larynx is this part right here. So the air through the nose passes into the pharynx, and then because epiglottis, this is epiglottis, because epiglottis is in this position, it permits the entry of the air into the larynx. So that's why we can consider pharynx a respiratory organ. I said that in the same time can be a digestive organ. Why? Because the second part of the pharynx is right behind of the oral cavity. So the food from the mouth passes into the pharynx. In deglutition time, if you remember from last time, this soft palate goes upward and becomes horizontally. It um, shut the communication between the nasal and oropharynx, and in the same time this epiglottis goes downward and it shuts the entry into the larynx, so that the food from the mouth passes into the oropharynx and then to laryngopharynx, and then it must go downward to the esophagus. So this is why we can say that pharynx is a respiratory and a digestive organ. Of course, if it is a musculomembranous organ, so um, we can say that it starts from the skull base right here, and it is followed by the esophagus. Not very long, usually 15 centimeters, and it's visible that it has a part inside of the head. This will be the cephalic part, and it has a part inside of the neck. This will be the cervical part. It has a conical shape with the flat part superior. The finas part is inferior. So, naso, oro, and laryngopharynx. Let's see how it looks. How are the external and internal configuration? If you look to this picture, you can see it's a posterior view. Posterior view, it means, look at it. This is the head. Occipital bone is cut, it's removed. You can see just the basilar part of this occipital bone and a little small parts from the lateral parts of the occipital. Right here, temporal bone, you can see the ear. So right here, this is our pharynx. Um, if you cut transversally, you can observe that it has a triangular shape with a posterior surface and two lateral surfaces. So this part which you can see here, this is posterior surface. We can describe superior and inferior extremities. Okay, Let's take each surface in part. Look at this picture. Again, this is the nose, this is the mouth, this is the larynx. Right here starts trachea. Behind, right here, sphenoid bone. Right here, basilar part of occipital and vertebral column. Um, this posterior, right here, this is the pharynx. Posterior surface of the pharynx, it's located in front of the vertebrae, but um, you know that the vertebrae they present in front the body, the vertebral body. Actually, right here you can see it's like a thin line. Um, there is a plane, a muscular plane, because it's in front of the vertebrae. We can say it's prevertebral muscular plane. These muscles must be protected by a fascia, prevertebral fascia. So the posterior surface of the pharynx, right here, has relations with fascia, with muscles, with vertebrae, and with the sympathetic trunk, the cervical sympathetic trunk. We will study this sympathetic trunk a little later this semester, but it's a part of the nervous system. Attention. Um, Here is not very clear in the picture, but in the real body you have to know that between the pharynx and the vertebrae there is a space, because it's behind of the pharynx we say retropharyngean space. This space is very important because it contains some fat, some elastic conjunctive tissue, and in the same time it has two lymph nodes. Um, Actually, this space it's important because it determines the mobility of the pharynx, and it protects the pharynx from the vertebral bodies, because you know when the food passes through the pharynx, because of the muscles it suffer a little dilatation. So this space permit this dilatation and doesn't let the pharynx to come in contact with the vertebrae. What we have laterally, remember three surfaces, one posterior, which you saw before, and two lateral surfaces. The lateral surfaces are here and here. Um, the part which is inside of the head, the cephalic part, has relations with the gland, the parotid gland. It's not visible, but you know that it's right here under the ear. So um, relations, the most important relations in the cephalic part will be with this gland. And in the cervical part, you can see here the sternocleidomastoidean muscle. We can divide this part, which is inside of the neck, in two segments, superior and inferior. Superior, right here, and inferior. In the superior part, relations are a little different if we compare with the inferior. Why? Let's take first this artery. It's the common carotid artery. You know that it comes from aorta, and right here it is the common carotid artery is divided in one um, external and one internal branch. You can see here external and internal branch. So if we speak about the upper part of the cervical region, relations will be with external and internal carotid artery. If we speak about the inferior cervical segment, relations will be with the common carotid artery. Both of them, superior and inferior, they have relations with jugular vein. We can describe here some branches from carotid, for example, thyroidean artery, lingual artery. In the same time, we have relations with nerves. You can see here this yellow, which is vagus nerve, but um, hypoglossal nerve is presented in this region too. Okay, another relation is with the thyroid gland. This is a lateral view. This is the inferior part of the pharynx. Right here we can see a part of the larynx. Please don't confuse pharynx with the larynx. So it's visible that pharynx has relations here with the posterior part of the thyroid gland. Okay, In the lateral parts, there is that space. I just want to remember you about it, but we spoke about it last time, lateropharyngeal space. L- that space, which is important because it contains that muscles, stylian muscles, the muscles which connect the styloid process of the temporal bone with the tongue, for example, with the pharynx, with the hyoid bone. So this space divided by these muscles in two regions, one anterior and one posterior. We can say pre and retrostylian. Why it's important? Remember, we have a lot of big blood vessels here and nerves. Let's take each segment of the pharynx separate. First of all, nasopharynx. Look at it. The blue part, the selected part, it's a picture taken from the anatomy table. You know that I like it. So um, I said that the upper part, the pharynx starts from the skull base. So the upper wall of the nasopharynx is the base of the skull, and the inferior limit, it's not a real wall. Actually, we have a real wall just in deglutition time. Other way, it's an imaginary line which passes through the palatine arch or soft palate right here. So this nasopharynx communicates with the nose in front, and inferior communicates with oropharynx. The pink part here is the second segment of the pharynx. Nasopharynx is the most complicated part of the pharynx because it has a lot of important details. So let's see this picture. Again, it's a sagittal view, so a medial view. Right here you can see the nose. I'm sure that you recognize nasal concha and uh, ethmoidal concas. You know, we have two ethmoidal concas, the middle and the superior. Palatine region with the hard palate, soft palate, oral cavity with the tongue, and palatine tonsil. We spoke about palatine tonsil last time. If you look here, this is the pharynx. So nasopharynx is exactly this part right here behind of the nose. The upper wall is represented by the skull base. Actually, is the sphenoid bone, the inferior surface of the body, and the basilarity process of the um, occipital bone. This superior wall is very important because it contains some lymph nodes. Uh, we can compare these lymph nodes with these lymph nodes which form the palatine tonsil. Um, but in this case, the tonsil will be pharyngean tonsil. Um, there is a difference between this tonsil, pharyngean tonsil, and the rest of the tonsils in our body, because this is the only one which regress in time. So after 16 years, usually it disappears. In case of hypertrophy, we can speak about the adenoid vegetation. So um, the kids with hypertrophy of this tonsil, they cannot breathe very well. So you can recognize them very easy because they always stay with the mouth open. They breathe more through the mouth than through the nose. So remember, it disappeared after 16 years. There is something more in this upper wall. It's not represented here, but we have some cells, epithelial cells, which are actually rest from the first hypophysis duct. So you saw the superior wall. Inferior wall, remember I said it appears just in deglutition. So when the soft palate goes from this position horizontally and shut um, this orifice. So attention just in deglutition. What we have behind, this is posterior wall. You can see it has relations with the vertebrae, actually with the first and the second, with the atlas and axis. There is something very important here. The naso, oops, nasopharynx, it communicates with the middle ear because there is here a canal, a tube, auditive tube, or Eustachian tube. So the orifice of the pharynx um, is on the lateral wall of the pharynx, this orifice, which permit the communication with this tube here, or you can see it here. Attention, this is the the left auditive tube. In this picture, you can see the right, but because it's a medial sagittal view, we can see sorry, just the orifice. Look at it. So right here starts that auditive tube. It's important that this orifice it's encircled here by a prominence. You can see this prominence. Right here starts a muscle. The name of the muscle is salpingopharyngean. Salpingo because of the auditive tube. If we go more backward, behind of this prominence, right here there is a depression this time. So this is prominence, this is a depression. The name of depression is pharyngean recessus. Attention, please don't confuse recessus with rapheus. You will see very soon pharynx has a rapheus. Um, you will see it very soon. Okay, there is something more. um, this orifice is not represented here, but on real body is encircled by another group of lymph nodes, which form another tonsil. So till now you know the tonsil from the tongue, the palatine tonsil, pharyngean tonsil, and right here tuber tonsil or Gerlach tonsil. Look at this picture. So on the tongue is the most inferior. So on this group, lingual tonsil. On each side, we have palatine tonsil inside of the mouth. Pharyngean tonsil is just one on the superior wall, and each lateral wall of the pharynx present tuber tonsil. So we have totally 6 tonsils, and because of their position, we can imagine they are on a circle. The name of the circle is Waldeyer ring. Let's take the second part, oropharynx. The blue, um, it's behind of the mouth, behind of the oral cavity. That's why oropharynx. It is limited by the palatine arch right here. And inferior, it's an imaginary line which passes through the hyoid bone. Hyoid bone is visible right here. So from this point to this point, we can say this is oropharynx. It's behind of the mouth. It communicates with the oral cavity through this space. Actually, we say that this space is an isthmus, a bucopharyngean isthmus. It's limited by the palatoglossal arch right here. This is palatoglossal um, arch. It's a muscle actually, but you know it's visible if you look to your mouth. It's like a fold, uh, more mucous than muscular, but it has muscular fibers in its structure. So this arch limits superior, this oropharynx, and inferior there is tongue, root of the tongue. The last part, laryngopharynx. So again, this was nasopharynx, this was oropharynx, and the blue part now is laryngopharynx. Laryngopharynx because it's behind of the larynx. Right here you can see it, all this white part. Attention, this is hyoid bone and this is larynx. This is actually thyroid cartilage and this is cricoid cartilage. Cricoid cartilage is like a ring with a flat part posterior. So if we speak about the limits for the laryngopharynx, superior is that imaginary line which passes through the hyoid, and inferior it's another imaginary line which passes through the cricoid cartilage. This is laryngopharynx right here. So again, naso, oro, and laryngopharynx. Because of its position, we can say that it has relation with epiglottis, with the root of the tongue, with the tonsil, lingual tonsil, which is right here on the superior surface of the tongue, but on its dorsal part. And I'm sure that you remember the tongue is connected with epiglottis by glossoepiglottical folds, which are three in number, so we can mention them for the relations. This entry into the larynx, we say it's laryngean aditus. Pharynx is a musculomembranous organ, so it means in its structure we can find muscles and mucous membranes. So we have two group of muscles um, which are protected by an adventitious, which is a connective tissue, and by an aponeurosis, and the deepest layer is represented by the mucous membrane. So if you take in order from inside to outside, there is a mucous membrane, aponeurosis, muscles, and then sorry, and then we have oops, and then we have that adventitious. Okay, how are the muscles? Because these are the most important parts. We have two group of muscles. We have constrictors muscles and longitudinal. Constrictors, they are circular. There is one superior, one middle, and one inferior. Um, the function of these constrictors, which looks inverse like the tiles, because you can see the superior is covered in its inferior part by the middle constrictor. The middle is covered on its inferior part by the inferior constrictor. So they are constricted successive, so in this way determine the progress of the food downward. Um, if we remember exactly position of the first segment of the pharynx, it's easy to understand that origin for this um, superior constrictor will be on the sphenoid bone, on its pterygoid processes. Um, in the same time, has some fibers which start from mylohyoidean line. I'm sure that you remember this line. It's on the internal surface of the mandible. Um, it's exactly that part which separates sublingual by submandibular fossa. Um, the second part, for example, if we take it, it has relation with hyoid bone. So of course origin will be there and on the root of the tongue, and inferior, because of the relation with the larynx, which is a cartilaginous organ, origin will be on these cartilages. Insertion is behind because in this picture you can see just the left side of the muscle. The left and the right um, parts of the muscles are connected together behind. So I want to show you how. Look, in this picture, you can see posterior view of the pharynx. The blue part is inferior constrictor. The vertebrae are removed to see the pharynx. But let's see how are they connected behind. Look at it. So superior, middle constrictor, and inferior. Where the left and the right half are meeting together, result here rapheus. Again, don't confuse it with recessus. Recessus was that orifice on the lateral wall of the nasopharynx. Rapheus is this. Good. So constrictors, you saw superior, middle, and inferior. They are very important because they determine the progress of the foot downward. But in the lateral side, we have another group of muscles, longitudinal muscles, which determine the pharynx to be moved up. So they are levators. They are contracted in the same time, so they levate the pharynx. For example, you can see here stylopharyngeon from the styloid process of the pharynx. I'm sure, styloid process of the temporal bone. I'm sure that you remember it. Another muscle, palatopharyngean. Palatopharyngean you can see here. So from palatine region to the pharynx. Salpingopharyngean, which was here behind of the that orifice of auditive tube. So actually both muscles, both groups, constrictors or and levators, they determine, um, they're important in deglutition because they help the progress of the food downward. Finally, vascularization. Pharynx has its proper artery, pharyngean artery, which is a branch right here. You can see it. It's a branch from the carotid artery, external carotid artery, but it receives other branches from the palatine region and from sphenopalatine. You can see here sphenopalatine. It's a big artery which determine branches for upper part of the pharynx, for nasopharynx. Venous blood is collected by the veins. You can see here there are a lot of veins. All of them, they go to the internal jugular vein. And about the lymph, if you remember from the last time, I said that on the lateral part of the neck, on each side, we have some cervical lymph nodes. And of course, today you saw that behind of the pharynx, there is that space, retropharyngean space, which contains two cervical nodes. And finally, innervation, we have branches from glossopharyngean nerve and from the vagus nerve, and in the same time some vegetative fibers from the sympathetic trunk. Okay, so this is it about the pharynx. uh, till the next time, stay strong, be positive, and take care of you. Thank you. Ciao ciao.